So when you're talking about overall potential side effects after treatment for prostate cancer, one of the things we'll talk about is what's called urethral stricture, or narrowing of the urethra. And it happens in about 5 to 10% of treatments that range, really any treatment: surgery, radiation, brachytherapy, cryotherapy. Anytime there's energy delivered to the prostate or surgery in that area, there's a possibility of this urethral stricture. So it happens again about 5 to 10% of the time. And what it is narrowing of this urethra. So if this is the prostate here, and energy is delivered to this prostate, other areas can be affected by that radiation and scar tissue can develop. And again, you can see narrowing of the urethra through this area. In the case with surgery, it's more commonly going to be at the neck of the bladder where the prostate was, and you'll get narrowing of this area, and this is called a bladder neck contracture. And it's essentially the same thing. It's narrowing of the urethra. And again, it can happen with any treatment for prostate cancer. All of these treatments, it's important to talk to your doctors, know the risks ahead of time. Each procedure has different specific risks for that type of treatment. Again, urethral strictures is one of them. It's not very common, but when it does occur, it can cause difficulty with urination, weak stream, irritative and obstructive voiding symptoms, incomplete bladder emptying, and it even can cause some leakage in some situations. So important to know, not very common, again, 5 to 10%. And there's treatments. A lot of times these areas need to be dilated or things like that if it does happen. But again, that will be guided by your urologist. That's it. Dr. William Stiles, thanks for watching. We're talking about urethral strictures.